Hey everybody, Dr. Rafich here from Vet Triage, Sunday, October 27th, 9:29 p.m. Pacific time, a little bit late tonight, but it's been a busy day being after returning from ACVS in Phoenix, Arizona. So we are continuing through this issue of JAVMA. This is January 15, 2016 edition, and we're talking about a survey of occupational hazards, there we go, in Minnesota veterinary practices in 2012. Let's get into it. So they had a survey of Minnesota veterinary personnel between February 1st of 2012 and December 1st of 2012. What they found were 93% of veterinarians had pre-exposure rabies vaccines, which were more than the 54% of technicians. During their career, 27% of respondents had acquired at least one zoonotic infection, zoonotic meaning transmitted from animal to person, and 77% of respondents had been injured by a needle or other sharps or anything with a point to them. The recapping of needles was reported by 87% of respondents. The most common reason reported by veterinarians and veterinary technicians was being trained to do so, this is recapping the needles, at school or work, and that's 41% of veterinarians, 71% of veterinary technicians. Recent feelings of depression were reported by a quarter of the respondents, a greater proportion of technicians, which are 42%, than veterinarians, which are 21%, indicated working in an environment that employees experience some form of workplace abuse. Let's go into the introduction. Previous surveys revealed that 50 to 67% of veterinarians and 90% of technicians experience animal-related injury at some point in their career. This includes animal bites, kicks, scratches, being crushed by equipment used for animal restraint. Other hazards include chemical, physical, and biological. Dermatophytosis, which is ringworm, and bite wound infections are the two most commonly reported zoonotic infections of veterinarians and technicians. Radiation exposure, needle sticks, and sharp injuries are also commonplace. Musculoskeletal disorders are associated with trauma and repetitive movements. Shoulder, neck pain in large animal vets comes from rectal palpation, and that's most commonly reported musculoskeletal disorder in the field. Chemical agents used in veterinary practice includes topical meds, hormones, pesticides, disinfectants, anti-neoplastic, so chemotherapy agents. Environments in which animals are kept can pose both respiratory and physical health hazards to folks. Asthma, allergies, hearing loss, frostbite, other conditions, reproductive hazards that can affect the pregnancy or reproductive status of women of childbearing age. Mental health or psychological hazards like stress, substance abuse, or certain conditions in the workplace lead to depression, anxiety, and suicidal ideation. Materials and methods. Animal injuries were defined as an animal-induced injury resulting in hospitalization, missing half a day of work, or inability to work for at least 5 days. And so it's probably, I'm going to go based on this, that it's probably a bit underreported then, because their definition of animal injuries are very strict and severe. I'm sure there are plenty of times where you get like a cat scratch and you don't go to the hospital, or you don't leave work. You get a dog bite, but it doesn't break the skin. So that happens a lot. So it's maybe a bit of an issue here for this paper. 45% of respondents were veterinarians. This is the results. And 9% were office staff, 44% veterinary technicians. It made up 2,034 licensed veterinarians. That's the Minnesota Board of Veterinary Medicine reporting how many vets are in the state, so over 2,000. And technicians are estimated at 5,600. So this study represented 19% of licensed veterinarians, 7% of veterinary technicians. Median age, 39 years old, 80% female, 98% white. Most were small animal. Small animal personnel were significantly younger and more likely to be female than large animal. Similarly, small animal veterinarians were also more likely to be female than large animal vets, 72% versus 46%. A large proportion of veterinary technicians worked in small animal practice, 48% versus 35% for large animal. Now they want to talk about infectious disease. 70% of personnel report having pre-exposure rabies vaccinations. Veterinarians received pre-exposure rabies vaccinations at 93%, veterinary technicians 54%. A higher proportion of veterinary technicians versus vets were tested for rabies neutralizing antibody titers within 2 years before the survey date. That's 35% of veterinary technicians versus 29% of veterinarians. And so what this implies is that the rules typically are, the law is, I guess, you're supposed to get rabies tested every 2 years after you've received the vaccination. 13% of vaccinated veterinarians and 3% of technicians reported not having the rabies tested for over 10 years. 27% of folks indicated acquiring at least one zoonotic infection, dermatophytosis at 68%, dog bite wounds in general, 48%, 37% of respondents, including veterinarians at 35% and veterinary technicians at 39%, and 32% for office staff, were familiar with the National Association of State Public Health Veterinarians Compendium of Veterinary Standard Precautions for Zoonotic Disease Prevention in Veterinary Personnel. 42% of personnel indicated their practice had an infectious control plan. Now, physical hazards. 32% of respondents reported sustaining an animal-related injury. 34% of vets and veterinary technicians alike reported sustaining a serious injury during their career. 6% and 5% of veterinarians reported sustaining a serious animal injury within the past 12 months. 39% of vets reported self-medicating their illnesses or self-treating their injuries, compared with 13% of veterinary technicians. Needle stick or sharps were commonly reported in 77% of respondents, having sustained at least one injury at some point in their careers, 41% within the past 12 months. 88% of vets, 91% of technicians, 68% of office staff reported recapping needles after using them. Vet techs were more likely to have been trained to recap needles at school or work versus veterinarians. That's 71% versus 52%. A greater proportion of veterinarians and veterinary technicians reported unavailability of dedicated disposal containers as a reason for recapping needles. That's 41% versus 25%. Vet techs were more likely to perform radiographs than veterinarians, 95 versus 85%. Next category is musculoskeletal disorders. 35% reported that they had at one time developed a disorder because of work. Back pain, shoulder pain, neck pain, wrist pain were most common. Large animal vets at 57%, small animal vets 39%. Now, chemical hazards. The handling of various chemicals. So hormones, 35%, cleaning agents, 88%, sterilization agents, 72%, chemotherapy at 11%, chloramphenicol, 18%. Chloramphenicol is antibiotic, and it's been known in people, if you touch it with your skin, it can cause anemia. I think anaplastic anemia. And then pesticides, 27%. The scores of frequency of glove use when handling chemicals, median score was 3, which means sometimes. It was like 1 to 5. Chemotherapy was 5. Respiratory health, new category. 16% reported having asthma. 10% had asthma before working in the veterinary field. 5% said their asthma got worse since working in the veterinary field. 1% had no change, had to change their career focus because of asthma. 26% have allergies. 17% having had those allergies prior to working in vet field. 12% said their allergies got worse in the vet field. 2% had to change careers because of it. And then finally, next up, mental health. 89% said they're pretty happy in their position. Let me see. 34% reported that workplace stress adversely affected their health or well-being in the past 12 months. 8% missed work because of stress in the past 12 months. There were no differences between veterinarians and veterinary technicians. That's interesting. Type of hostile work environments include Social exclusion from employees at 23%, yelling 13%, bullying 11%, throwing items 7%, threats 28%, and physical violence 5%. A significant, sorry, I misread it. Social exclusion at 23%, yelling at 13%, bullying 11%, throwing items 7%, threats 3%, physical violence 1%. A larger proportion of veterinary technicians and veterinarians were more likely to report at least one of these things. 42% for technicians, 21% for veterinarians. 20% of respondents indicated feeling little interest or pleasure in doing things, and 25% reported feeling down, depressed, or hopeless during their career. 22% said they sought medication for depression. 16% had doctor-diagnosed anxiety. 9% had doctor-diagnosed depression. There were no differences between veterinarians and technicians. Reproductive health. 43% reported at least one pregnancy during their career. 6% believe they had experienced adverse reproductive outcomes like miscarriage or preterm labor as a result of the work environment. Miscarriage was 41% and the most commonly reported. 93% of female respondents who were ever pregnant during their veterinary career reported taking additional precautions while pregnant, like wearing gloves more frequently at work at 23%, avoiding heavy lifting at 39%, limiting radiation exposure at 53%. 82% of female respondents reported participating in at least one activity that could adversely affect the pregnancy while pregnant, including restraining animals for radiographs at 30%, participating in animals recovering from surgery, 39%, actually recovering animals, 67%, and these are with inhalants being used. For those handling reproductive hormones, 4%, topical parasites or other chemicals, 37%, without wearing gloves. Lifting animals or equipment that weighed over 22.7 kg, so 50 pounds, without assistance, 27%, working more than 40 hours a week, 73%. 32% of female veterinary personnel report that their employer required to take additional precautions when they were pregnant. 10% reported resistance from employers or colleagues when they tried taking precautions. A larger proportion of veterinary technicians reported mandatory workplace safety policies for pregnant employees than did veterinarians. So that's veterinary technicians at 38%, veterinarians 24%. And then workplace safety culture. Last thing here, 35% of respondents indicated that they consider their job to be dangerous. Between 72 and 94% agreed or strongly agreed with statements regarding safety culture in the workplace. 31% reported having been taught or having witnessed veterinary personnel being essentially instructed to protect the veterinarian at all costs. So discussion. 32% of Minnesota veterinary personnel in the study have had sustained serious animal-related injury. Other reports between 50 and 98% in the United States. Veterinary technicians were just as likely to sustain animal injury as veterinarians. Designated containers for discarding needles or other sharps should be located in every area. Veterinary support staff should be taught proper needle handling techniques and the importance of proper needle disposal. Obviously, most veterinary medical colleges require students to be vaccinated against rabies, whereas most Minnesota veterinary technology programs, so for veterinary technicians, recommend but don't require rabies. You should have serum antibody titers against rabies checked every 2 years and receive a booster if the titer is less than 1 to 5, as determined by a rapid fluorescent focus inhibition test, or approximately 0.10 units per milliliter. 9% of respondents completing the survey who received pre-exposure rabies vaccinations were over 10 years overdue to check these titers. Ringworm was the most common zoonotic infection. Others include bite wounds, enteric infections like by Salmonella or Cryptosporidium. Previous studies have shown that lifting, performing surgery, and rectal palpation and animal handling relate to musculoskeletal disorders. There's no association between small versus large animal. The lack of association might be explained by veterinary practices having scales that the animals can walk on and using ultrasound instead of doing rectal exams for pregnancy checks in large animal. In 2012, the prevalence of asthma in adults in the United States was 8%. 16% identified in veterinary personnel, so double what the US is. 26% of veterinary personnel have allergies, 9% in general population. 10% of veterinary personnel in this study had asthma, 17% had allergies before working in veterinary medicine. Exposure to organic dust, animal dander, and other pro-inflammatory compounds may be implicated. Spontaneous abortion, low birth weight, and preterm delivery are all risks. Working over 40 hours per week and participating in work activities that require bending, lifting, and other strenuous activity can increase the adverse effects, reproductively speaking. Personnel at risk of animal-related injuries, needle stick or sharp injuries, acquiring infectious diseases, and exposure to radiation and harmful chemicals. These can affect gestation. Studies have shown associations between spontaneous abortion and performance of tasks such as collecting radiographs or recovering animals from anesthesia. Most of the women also report participating in activities that could adversely impact pregnancy, suggesting a disconnect between attitudes and practices. A study in the UK suggested that veterinarians are twice as likely as physicians, nurses, and dentists to commit suicide. Healthcare professionals are 4 times as likely to commit suicide as the general public. 9% of respondents reported doctor-diagnosed depression, and this proportion exceeded the 5.9% of all Minnesota residents as having depression from 2008. Despite a third of respondents reporting they have considered their occupation to be dangerous, most indicate they are happy with their jobs. For veterinarian respondents, the median age is 48 years old, 61% females, compared with 47 years old and 55% female for veterinary technicians. And then finally, it is not possible to eliminate all hazards in the workplace. You have to adhere to a well-developed employee safety and health program. You need regular staff meetings. Veterinary colleges and veterinary technician programs should include specific workplace safety and occupational health lectures or courses in their core curriculum. Veterinary medical organizations should provide continuing education. Veterinary practice owners and managers should take a leadership role in creating a healthy work environment by championing and modeling desired behaviors. Yeah, and so many things to take away from this article. The mental health part resonates true for me because vet triage, the entire goal of it is to help with the work-life balance of folks. So that's it for that issue. We're done there. We'll start a new one tomorrow. Thanks everybody who are watching and listening. We'll see you at the next one. Bye-bye.